Rhinoplasty, often called a nose job, is not just a cosmetic surgery, it's a profound step in enhancing facial harmony or addressing critical health issues. The nose, as a central feature, significantly impacts aesthetics and function. This dual-purpose surgery, aimed at either refining appearance or correcting medical issues like breathing difficulties, has been a cornerstone of modern cosmetic and reconstructive surgery. In this video, we'll explore rhinoplasty's intricate details, from its history and types to surgical techniques, recovery, and psychological impact. Whether you're considering this procedure or simply curious, this analysis will provide everything you need to know. 1. What is rhinoplasty? Definition and purpose. Rhinoplasty reshapes the nose's cartilage, bone, and soft tissues to achieve a balanced appearance or resolve functional issues. Originating in ancient India around 500 BC, this practice has evolved significantly, transitioning from a medical necessity to an art form blending aesthetics with medical precision. Key goals of rhinoplasty include aesthetic adjustments, addressing issues like nasal asymmetry, humps, or drooping tips. Functional corrections, treating breathing problems caused by structural anomalies like deviated septums. Historical context. The journey of rhinoplasty spans centuries. Ancient practices. Documented in Indian surgical texts around 600 BC, it focused on reconstructive needs, particularly for trauma or punishment-induced nasal deformities. Middle Ages. The practice waned in Europe but thrived in the Middle East. Modern era. By the 20th century, rhinoplasty became a blend of artistry and science, incorporating techniques like open and closed rhinoplasty. 2. Types of rhinoplasty. 2.1 Open rhinoplasty. This approach involves an external incision at the columella, lifting the nasal skin to provide full visibility of internal structures. Advantages: precise correction of complex deformities. Easier access to cartilage and bone for reshaping. Disadvantages: longer recovery times. Small visible scar at the incision site. 2.2 Closed rhinoplasty. All incisions are made within the nostrils, leaving no external scars. Advantages: quicker recovery. No visible scars. Disadvantages: limited access to nasal structures. Less suitable for extensive modifications. 2.3 Non-surgical rhinoplasty. A minimally invasive option using fillers like hyaluronic acid to address minor cosmetic concerns. Advantages: quick procedure with minimal downtime. Lower cost compared to surgical options. Disadvantages: temporary results. Limited to minor corrections. 3. Preoperative considerations. 3.1 Patient evaluation. A thorough assessment ensures optimal outcomes. Analyze facial symmetry and nasal structure. Discuss aesthetic goals and functional concerns. Use photographic documentation for planning and communication. 3.2 Medical history assessment. Screen for conditions that might complicate surgery, e.g., allergies, previous nasal surgeries. Evaluate skin type and elasticity, as these influence healing and final results. 4. Surgical techniques. Successful rhinoplasty requires a meticulous surgical plan, incisions, strategically placed for minimal scarring. Structural manipulation, adjustments to cartilage and bone for desired shape and function. Grafts, sometimes used for support or reshaping. 5. Postoperative care. Recovery is a gradual process requiring diligence. Initial days, use ice packs, elevate the head, and avoid strenuous activities. Long-term healing, swelling subsides over several weeks, with final results visible in 6 to 12 months. 6. Risks and complications. While rhinoplasty is generally safe, potential complications include infection, managed with antibiotics. Bleeding, controlled with nasal packing or cautery. Scarring, typically minimal but varies by technique and individual healing. 7. Psychological impact. Rhinoplasty often improves self-esteem and body image, but it's essential to set realistic expectations. Address underlying psychological concerns preoperatively. 8. Ethical and legal considerations. Informed consent is paramount. Surgeons must clearly communicate realistic outcomes. Potential risks and complications. 9. Future trends in rhinoplasty. Advancements are shaping the field. 3D imaging and printing, enhancing surgical planning and patient communication. Tissue engineering, offering potential for more natural, durable results. minimally invasive options, meeting the demand for quicker recovery and less downtime. Rhinoplasty is a transformative procedure with the power to enhance aesthetics and functionality. Its success hinges on detailed planning, skilled execution, and patient education. Whether you're considering surgery or exploring its intricacies, this in-depth analysis highlights the importance of informed decision-making and the ever-evolving nature of this fascinating field. Have questions or experiences with rhinoplasty? Share your thoughts in the comments. Don't forget to like, subscribe, and hit the notification bell for more insights into cosmetic and reconstructive procedures.